So, Dr. Emilia Ferreira is planning to join this morning. But I didn't want to start this too late. So, we are really excited about the conversation that we kicked off last week about oxytocin. And, I come to it from the perspective of a lactation consultant. So, I think of the hormonal effects of, what's happening during breastfeeding and during lactation. So, that's how I tend to focus on it. And of course, then I have the normal, like, mainstream understanding that oxytocin is released when we hug someone we love, when we pet a dog. It has really good effects on us, being able to calm down and keep our blood pressure down. So that is where I'm coming from. But she is a neuroscientist. Dr. Ferreira has such an extensive background in studying the brain and how neurotransmitters and hormones work. So she was bringing me just things I've never thought about. So last week, one of the things that came up was talking about when oxytocin is released as a result of a positive interaction with a person that you care about, especially in the context we're talking about, raising children. When you have these positive interactions, the long tail of how oxytocin acts in your body is extremely important to remember. So she was talking about how oxytocin is being released and what it's doing for the body. And I said, so if, the child is upset, if the child is having trouble regulating themselves, giving them a hug, doing something that's going to stimulate oxytocin. And she said, no, 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 no. You have to go back and watch this because it's pretty funny. She really shut that down quickly. She said, no, that's not when you do it. This is something getting an oxytocin release collectively between the two of you in your relationship early in the day sets up the rest of the day to make it less likely that they're going to have that moment of dysregulation or that moment where they can't calm down. And also you too, as the parent. And I was just blown away. I mean, I was like, the light bulbs were going off right in front of my face. So I really took that to heart as we were, getting through the rest of the conversation. And she said something that it really intrigued me. And it was my plan to ask her about this today because she said more than once, and one of them may have been off camera. She said, and that's this side of oxytocin. So she foreshadowed that there's more she wants to talk about when it comes to oxytocin. Now, I want to talk about it as well. And one of the ways that I've typically done that in my lactation career is when I do a lot of teaching that has to do with parents who have babies in the NICU. And there's a great story from my friend Elizabeth, who she is a NICU nurse. And before she was a NICU nurse, before she was a nurse at all, she was my fellow mom in a breastfeeding support group, and we raised our babies together. We breastfed together. We learned about breastfeeding together. And later on, when her babies were a little bit more grown, she went to nursing school, and she is a brilliant nurse. And she is a fantastic NICU nurse because the patients that she takes care of there, their mothers and their mothers' partners walk away with the understanding that breastfeeding is still possible, even though their baby was born early or had a problem. So she always is able to impart that, I think, because of her lived and embodied experience as a breastfeeding parent. But she really is that kind of person that has sort of insights about breastfeeding that she's never afraid to share in the way that sometimes I think that other hospital staff can be a little bit standoffish. Elizabeth is not that at all. She's never been accused of being too forward about pushing breastfeeding on parents. And I think that's just because her conversational style. But one of the things that she told me that I've used ever since when I'm teaching, she was talking to some parents who were in the NICU visiting their baby. And it was like, I want to say it was like the second day of their baby's life. So, they had this opportunity to have a breast pump set up. And at home, they had an electric breast pump been provided by their insurance. It was a really good one. And that when they came in, they were both a little agitated, the both parents. And Elizabeth, of course, was communicating with them about what was going on. They were very frustrated because she was pumping and pumping, and she said nothing's coming out. And the father's like, "We spent this money on this pump, and she's been doing everything that every nurse told her to do, and it's not working. We don't know what else to do." He was very agitated about this because he understood that it was important, and he wanted to figure out if somebody was holding back information from him, essentially. And so she said, "Well, you know what? Let's try something. Let's do something, different than what you've been doing, because usually that helps. Since you're here, and since the baby is, we've already fed the baby, or the parents had already fed the baby." She said, "Why don't we just sit here and we'll do a little hand expression while you're here? You're looking at the baby. You could smell him. He's right here. You could touch him." And the father said, "Why would we do that? We have a perfectly good pump, and you have one here too in the hospital at the bedside for her to use. We're just going to pump." And Elizabeth said, "Well, you could, but I mean, as you've seen, you're just not getting a whole lot of milk to come out with the pump. So we could try hand expression." And he said, "Why would we do that?" And she said, "Well, here's why. Because a pump is a machine you plug into the wall, but your hands are attached to your brain." And she says that instantly his entire the way he was sitting there changed. He was like, "Oh, okay, that makes sense." And so it was something that really, really struck me. And of course, it was a fairly successful experience for them. They were able to hand express, get some milk out, and things worked out. But it really struck her in that moment that when you use your hands to hand express, that is fundamentally one of the differences that's happening. Now, there are also mechanical differences in what a breast pump does at the breast versus what is happening when you're hand expressing. You are compressing the breast in a way that a breast pump doesn't, but a breast pump forms a vacuum and hand expression does not. So you're sort of filling in the gaps of what you're substituting for, because babies have suction and form a vacuum, and babies also compress the breast in multiple ways. But with hand expression, it's just a different way. Um, Also because your hands are attached to your brain. So the way that you get feedback from what you're doing is actually happening inside your brain in a different way than it does during pumping. Now, we've also seen research in the last few years, which has done functional MRI studies of what's happening during pumping versus what's happening during breastfeeding. And it shows different activation in different areas of the brain during each of those activities. And they're also going to be looking at the differences in what brain areas are activated during hand expression versus what's being activated during breastfeeding or during pumping. And it's so interesting to me because, I mean, we just are always so focused on what's on the outside and what we can see. And the big map of what's really happening is inside. We can't see it. It's just like breastfeeding, and there's so many things on the outside we're looking at, and we're measuring this and we're watching for that and we're observing this and we're looking at this over time. But we just have the smallest fraction of an understanding of what's happening inside two people's body when, they're breastfeeding, when milk is being made, all those transfers of feedback. And so when I think about oxytocin, I've always gone back to that story because there's just a different way that oxytocin is going to be released. Now, we know that there's also the part of oxytocin and milk release that's going to be that hormonal function has to happen. So there has to be an oxytocin, basically a pulse, in order to tell the cells in the breast to release milk. That's what stimulates the milk ejection reflex, which is just the fancy words for the letdown reflex. So there's that part of it, but there's also additional parts that happen during whatever experience a person is having, how they are breastfeeding and how milk is coming out of their body. So we actually have to think about the underlying map of what's going on there. And so when Dr. Ferreira said that last week, it really stimulated me to think about how is that setting up the rest of the day? So if we only look at breastfeeding in the moment for this conversation, if a baby is being breastfed and, say this is a baby that's older than a newborn. So maybe it's a 1 month old, right? So there's going to be quite a bit of interaction between mother and baby during that breastfeeding session. Because with newborns, it does sometimes feel just a little bit like mom's just in charge, moving the baby around. But there are also underlying things that the baby's doing. But just for the sake of picturing this, it's easier to picture like a 1 month old or a 2 month old at the breast and how they look into their mother's eyes. They might smile. They might come off and laugh. They might, there's different things that babies do at different ages when they're at the breast. So if they're doing those things and the mother's body is having an oxytocin release in order to breastfeed, and then on top of that, they're having an oxytocin release during that interaction because that's their precious baby. What Dr. Ferreira explained basically tells us that those oxytocin results are essentially going to last for 6 to 8 hours. So then at the next feeding, they're already primed for things to be smoother. And at the feeding after that, plus each time they're accumulating those experiences. And one of the reasons that we need to know this information and we need to think about it in these terms is that every time we learn something about how breastfeeding works and how it impacts both members of the dyad, we can then help people who are not breastfeeding for any reason to emulate that behavior or that reaction or whatever's going on. So we always have to know, like the one that I always think about is I remember learning this very early on that when we teach bottle feeding, we teach people to make sure that they alternate the side of the body that they give a bottle on, because left to your own devices, most of the time you will hold the baby in your non-dominant hand and hold the bottle in your dominant hand, right? So that just makes sense to us as adults. But once we know that babies are doing important eye development when they're switching sides during breastfeeding, oh, okay, so if we're bottle feeding, we got to make sure we switch sides. Like, it's the simplest thing, but it's very easy to understand why that would be happening. They need to be on both sides of the body during feeding experiences throughout the day and night so that they're getting that even, equal type of eye development. So understanding things like this about how it's working during breastfeeding is just like, it's so important so that we can replace it in those situations, but also so that we can explain it to people who are, you know, who are struggling, or people who are wondering, why is breastfeeding important, or why would I want to go back to it if I'm not doing it? We just have so many there's so many opportunities for us to be explaining things better. I've been thinking about this concept the past couple days of breastfeeding literacy and having some conversations about that, and just trying to improve how individuals interact with the concept of breastfeeding in the first place. And it's something we talk about a lot in the field of lactation. We're always trying to figure out what is it that people don't know that they need next, or how can we help make sure they have the information that they need to feel like they're making informed choices, because we know that informed choices in infant feeding are very likely going to lead to more people breastfeeding, and that's a public health imperative. So we think about all these ways that we can communicate. And I think, I've always thought there's just so many people in the world who never think about breastfeeding at all because it's not relevant to them. They're not there. So it doesn't matter. And then you've got people who just don't come to it until they come to it. When it's in front of them, then it's time to think about it. And then a lot of people just don't think about it again after that. And the reason we know this is because as a lactation consultant, people ask me when I meet new people, they say, "What do you do?" Which is always a very quick checklist in your head of, do I want to talk about what I do in a really granular way? Or do I want to say something more vague, like I help new parents with their babies? Or do I want to say, I'm a lactation consultant. I help new parents breastfeed their babies? Because you get different reactions from that. But no matter what you say, once breastfeeding comes into the conversation, you will often hear people say, oh, and then they tell you, here's what happened to me, right? They want to share their experience. And this happens for mothers, fathers, grandfathers, grandmothers. It happens with everybody. They really want to be able to share that experience with you, not because they're asking a question necessarily or wanting validation. They just don't get the opportunity to talk about it, right? It's just doesn't come up most of the time. And some of the people who are on here, I can see your names who's watching. You interact with the concept of breastfeeding pretty frequently, right? But there are also people on here whose names I see that I happen to know from Substack. That's not something that you normally interact with. So when we think about what we need to share with the world, we know that there are a lot of cultural myths and there are a lot of societal misunderstandings about breastfeeding and lactation. It would really help if we could get past some of those things. And one of the ways we have to get past them is to just ensure that everybody gets a really fundamental understanding of what breastfeeding is and how it works. It starts with the really most fundamental things, like breastfeeding happens between what we call a dyad. It's a mother and a baby. It's a mother baby. It's a dyad is two people who are dependent on each other, one more dependent than the other, but that dependence doesn't go away very easily. So there are interactions that happen during breastfeeding that are super important for the rest of both of their lives. And societally, in US culture, a lot of Western culture, we tend to put a lot of focus on what happens to the baby as a result of breastfeeding or not breastfeeding, but we don't think quite as much about what happens to the mother. And there are so many things that we do know and that we do understand that we either gloss over, we sum it up really quick because people really just want to hear about what's going on with the baby. So there's a lot of breastfeeding literacy that is really, really fundamental that would go a long way to helping people to understand why people are working so hard to make sure that breastfeeding can work for them. Because that's the truth. It's easy to think, well, these are the breastfeeding rates and this is when people drop off. And so that means that a lot of people don't want to breastfeed. And that's actually not what the data show us either. So we know that a vast majority of people who are having babies express that they want to breastfeed. We know this, and we know that they do start to breastfeed in the hospital. We have really good data capture systems for that. And, we work with people every day and every week who are struggling, working really hard, seeking out multiple ways of understanding what's going on with their body. And I think that improving breastfeeding literacy through parents, through healthcare providers, and just through the general public would go a really long way to fixing that and, to bringing people closer together in understanding, again, why are people working so hard to make breastfeeding work? When the conversation comes up in things that happen on TV and speeches that politicians give, it's a weird planet of what they're thinking about what breastfeeding is. It's like a bizarre thing. I heard a lecturer say yesterday, she's a PhD student in the UK, and she's doing some work on how teachers who are lactating are accommodated essentially in the workplace and what happens in their lactation scenario. And she said, and I thought this was really interesting because they don't use the same wording for this there, but she said that lactation needs are not supported, they are negotiated. And I thought, that's really an interesting turn of words because here in the US, we use the word accommodations in all of the legal and policy things that have to do with what do you do with a person who has extra needs in the workplace because they're breastfeeding a baby or because they're pregnant or because they have a disability? We call all of that accommodation. And when you say accommodation, that implies something special and extra that we're going to make sure that they have to either ask for it, we're going to make it hard for them to get it. Someone's going to have to hold us accountable because it's not easy for us to do that because it's not for everybody. And so those little, shifts in language, they really make a difference. I have no recollection of why I got into that part of the conversation, but I think, because breastfeeding literacy is not widespread. So people think that, people go back to work and they want these special accommodations so that they can keep breastfeeding. Well, some of the people who hear that, probably people that they work with, people that are maybe supervisors or managers in their workplace think, why do they have to do that? They don't have to do that. We have formula. Like that's not necessary. They're just choosing to do that because it's what they want for their life. And if people understood that that's not really how that decision-making process works, it's really a different thing. And I don't mean to get into a conversation here about paid leave or anything like that. It's really more about the realities of what it's like to breastfeed, what it's like to use a breast pump to express milk, to feed a baby, essentially. And when people have a better understanding, as I said before, got to circle back. If you have a better understanding of how breastfeeding works, then you have a better understanding of what you need to do if you're not breastfeeding, like what is not happening there that you need to replace. And so that feeds into our whole conversation about formula and why we need to, hold these companies to the fire on making better formula. This isn't about, they say that that's what they're doing, right? They say that they're working to make better formula. But the reality is that what they're doing is they're working to put into formula what we know is in breast milk, which we know many things that are in breast milk. We certainly don't know all of them. And breast milk is a living dynamic fluid that's always changing. It's made for the baby that is in that situation, in that present moment. The easiest way to think about it is that when a mother is breastfeeding her 1-month-old versus when she's breastfeeding her 6-month-old, the milk is different because the baby is a different age. So at a different age, at a different weight, at a different height, at a different state of brain development, at a different state of gut development, they need different things to be in their milk. So breast milk naturally changes all the time. And then there are fluctuations that happen throughout the day and night. I don't see Nico on here, but I've done a live with Nico Kennedy about circadian rhythms and breastfeeding. And that's an important component of the day-to-day changes that happen in breast milk. So what formula companies are trying to do is to take each little tiny piece of what we understand about how breast milk works and put it into their formula. And then they charge money for it, for having done that. And the reality is that around the world, there's the one piece of information we have. There's the one policy, the Codex Alimentarius, that says breast milk substitutes need to contain this specific ratio of macronutrients. They can't contain less than this amount of macronutrients. Beyond that, everything is just proprietary. Everything. It doesn't matter what the marketing says. It's all proprietary. It's not proven by objective scientific evidence. So all formulas have to meet up to the codex. And the companies want everybody to think that they're always trying to make them better. But if that was really the case, then they wouldn't, if they really were that magnanimous, they would want every baby to be able to get these allegedly best ingredients that they are putting in. And they wouldn't charge more for them and make them harder to access, right? So the whole system is flawed. The whole thing is so off. And without knowing that part of it, that all infant formula around the world, because all babies are the same, they require, the same amount of macronutrients to grow. Without knowing that, it means when you think about breastfeeding, it doesn't seem as important. And if you only focus on breastfeeding as what it does for a baby and you forget about what it does for a mother, then it's easy to dismiss. It's easier to dismiss. You can think, we can substitute this, we can replace that. So overall, it just leads to so much misunderstanding. And then when there's misunderstanding in the fundamentals of how lactation actually works, when you hear somebody who is a healthcare provider who honestly should know better say things like, well, once your milk comes in, then you can try to exclusively breastfeed, not understanding that milk production begins halfway through pregnancy. There's ways that we talk about things, and there's ways that people misunderstand things that are just so fundamental. So breastfeeding literacy is really this concept that everyone in the whole world walking around needs to have a better understanding of how it actually works, because we're not going to change anything if nobody understands why it matters, right? Like that's the whole so what part of this. We're talking about breastfeeding. That's the what, the so what. So the now what is just putting out there, the simplest, most fundamental messages about breastfeeding that people can understand and that they can take away with them. And, to know that there are people who are looking at these things from the perspective of, we get it that some babies are not going to be breastfed. And we get it that some mothers are not going to breastfeed. So we're going to figure out what happens during breastfeeding so we can replace that as best as we can for those who can't. It's always going to be like that. There's always going to be babies who are born preterm and ultimately are unable to breastfeed. There's always going to be situations where people are not making all the milk that they need, or they have medical situations. There's all kinds of reasons why sometimes it happens that a baby's not breastfed or a mother doesn't breastfeed. But there don't have to be as many as there are. Many of them are caused by misinformation and ill-informed society regarding breastfeeding and what it means. It's a critical part of public health and lifetime health for two people. It's not a decision that's for one person. So it's a decision that's really for two. So I'm thinking that maybe next week, we'll talk a little bit more about some of those, specific impacts for mothers. We'll kind of kick off some more breastfeeding literacy information, and I'll get Dr. Ferreira to come on another time. I'm not sure. I can't really pay attention to like other messaging while I'm doing this, so it's hard for me to kind of go back and forth. I'm not sure if she just didn't make it or what's going on. So we'll have her back on here. I can't wait to do that. And does anyone have any questions or anything else you want to talk about this morning while we're here? I have more time. So if anybody is interested, thank you for your comments over here. It's really nice to see people in the comments. It's nice to see that you're here, that you're watching. It's always weird when you think you're talking into the void, but I do like to do these because I can then share them also on my podcast, and I can put them out there into the world in recorded format because people do listen. It always surprises me, but people really do care to learn about this, and not only people who are, like I mentioned before, super invested, engaged with the concept of breastfeeding on a day-to-day basis because they're doing it or because they study it, or it's part of their job. It's, the more good information, the more positive messaging that we have, the better off we're going to be. One of the things that I wish they would study more is I would love to see some data on the intensity of messaging about breastfeeding online, which is negative versus positive. I do think that people encounter a lot of negativity. Um, and, part of that is because individual people who are struggling with breastfeeding, they need a space to share. And, online is for everybody. So they deserve to have venues to share their experiences and whatever benefits it gives them to be able to share in that way. But people who are planning to breastfeed, preparing to, thinking about it, getting started, struggling themselves, it's not necessarily healthy for them to only encounter negative messaging and stories of people's struggle. used to be fairly simple in terms of things, when I was pregnant back in the 1900s. Um, it felt like when you would get to the last couple weeks of pregnancy, it's very obvious that you're gonna be giving birth very soon, and everybody that you saw in public would tell you this horrifying labor story. Thanks a lot. Like, that's not what I need to hear right now. But that was the only place that I had to worry about hearing that because if I just stayed home, I didn't have social media to be blaring all these terrible labor stories in my face. But people don't really have that in this country anymore. That's not really the way that people engage with the world. So people do stay home and out of public, but they don't stay offline for the most part. So they do hear a lot of negativity around things, and that can make it really hard to understand that it's possible and there are people doing it. So it would help. Breastfeeding literacy is going to go a long way. And another thing that'll go a long way would be people sharing their good stories or sharing how good it is. And there are places where that happens. I mean, I see it on every once in a while, I go on Threads and I'll see people sharing good stuff about breastfeeding. I also see people sharing bad stuff, but I think maybe because it's shorter messages, it's easy for them to say, "I've been breastfeeding for this long and I can't I never thought that I would be," or "I love breastfeeding. I'm so glad I did it. I'm proud of myself." Things like that. Um, but when you get into longer formats, that's when you tend to see people who are telling longer stories. And I feel like the longer stories a lot of times are the negative ones. People have a lot on their chest and want to get it off. So those are just two things that, I think would help a lot. And going to work on that concept of breastfeeding literacy like a lot more. I really want that to be something that we can, collectively work into the overall conversation because right now, um, and Elena's here in the comments. I mean, she'll confirm. Like most of the conversation about breastfeeding that's happening is about tech and it's about products. And it's like we really jumped the shark here because we don't have enough. We're not doing enough about learning about breastfeeding and having the information that we need to be replacing things with tech and products. We still have a long way to go, but some days it feels like we're like way behind on this because that stuff's happening and people are buying it and people are using it. And we talked about this yesterday that people are bringing us their data from breastfeeding tools like the apps that they're using to track things or there's pumps that have like built-in trackers of some sorts of data. And when we do a lactation consultation, we're expected to incorporate that data. It's something that our client or patient is bringing to us. They're presenting it to us. So we're responsible to deal with it in some way before we've ever been trained to do anything like that. So we're doing the best we can to keep up with the proliferation, but it's getting really difficult. And it's getting really difficult to help parents focus on their baby and not on the tech and the products, and to slow down and remember that people have been breastfeeding for all of the time there have been people. And, just to think about the fact that around the world, people are breastfeeding like every day, every minute, every night. Babies are being born, babies are being breastfed, and they're being breastfed, for long periods of time. They are being breastfed in every country of the world, all over the place. It is happening. And if it feels like all the people around you are not breastfeeding, that is a small window. It just helps to widen that perspective sometimes and remember that. And so we're just working really hard. Yeah, the tech has overtaken the clinical conversation and the conversation with parents. We're just trying to keep up and again help them to slow down and remember everybody breastfeeds around the world. Everybody has challenges, obstacles, things that make it hard. Um, we talk about the barriers here in the US because in the US, we know what the barriers are. We've had amazing organizations do amazing research and work to very clearly identify the barriers to breastfeeding. Like, we know what those are. And when, when we talk about when we have this conversation, the same barriers are mentioned and everybody talks about it and we know what they are. We forget that in other countries, okay, maybe they don't have this barrier that we have here, but they have other ones. Like, it's not, everyone has structural barriers. Everyone has medical barriers. Like, it's ubiquitous around the world, but people find different ways to mitigate those barriers. And the conversation in the US, we have to remember, tends to be the loudest conversation because we culturally are loud and we are the most on social media that is in the language that we speak. So that's what it feels like for us. So we want parents to remember, like, it isn't just us that's struggling. There's other people that struggle with breastfeeding, and there are other people who are successfully overcoming barriers. So the barriers that we have are not insurmountable. And if they were, I think I would just shut the door on this office and like go on to a different job. I mean, as frustrated as I've been over the years, like, I've not thrown in the towel yet, because when I sit down with one mom and one baby, it all comes back. Like, you figure that stuff out as you go along, because every mom and every baby that, like, you see their face soften or you see the baby latch, you see the baby breastfeeding, you're like, okay, this is why I do it. It really is true. So we when we get frustrated, we get burned out, we focus in on the one-to-one. Um, it is when we take that really wide view, like, we think about how many people there are who are struggling, or how the tech is so much of the conversation. We have to calm ourselves down too. We have to remember, people do this. Sometimes parents are ill-informed. Some people are, getting a lot of their information from sources that want to sell them something. And that is true across so many sectors of our lives. It's not only about when people are having babies. It's true in a lot of places. So there are things we can do. Elena just turned me on to a book called Super Bloom by Nicholas Carr, and my copy got here yesterday. So she's a couple days ahead of me. She said she read it in one night. And she said I had to read it, so I promptly ordered it, and it's here. I'm in the middle of it. And that's something, we can talk about on a future episode too. Maybe she and I will get on here and we'll apply what we learned from Super Bloom to our constant oh, she said 3 days. She said, I'm not a hero. Well, also you have small children. So I think that gives you a little bit of extra, leeway there. So you read it quickly. But yeah, I think we'll apply what we learn from Super Bloom. We'll talk about that in the context of the other conversations that we've been having about what we can do societally to slow down the impact of tech and sort of allow healthcare to catch up with that. Because no matter who you talk to in healthcare, they're like, yeah, this is going fast and it's really hard for us to keep up with it. It's easy to say, well, telehealth has been a wonderful thing that has helped a lot of people get access to healthcare. Sure. But it also came with its own problems, and we know it's not perfect. And like, that's the most basic, simplest thing about tech that you can think about when it comes to healthcare. So there's so many other things. So that's what we'll do. I'll finish my book. Maybe some of you will read it too, and we'll come back to you with our thoughts on that. And thank you to everybody who joined. I really appreciate you. Um, yeah, Super Bloom, that's the book. And I can't wait to talk to you again. So everybody, have a great rest of your day or evening if you are not here in the US. Talk to you soon. Bye.